Knock, knock, knock. Hi, my name's Gloria. I'm going to be your nurse for today. I'm going to go ahead and close this for some privacy, and then I'm going to go ahead and fold my hands. May I check your wristband, and can you verify your first and last name and your date of birth? Okay, and on a pain scale of 0 to 10, 0 being no pain, 10 being extreme pain, where are you today? Okay, and do you have any allergies? Well, alrighty, so today we're going to be doing a head-to-toe assessment. It's going to take about 30 minutes. I'm also going to be using my hands and my stethoscope, so if that's okay with you, we're going to go ahead and get started. So the patient's general appearance, patient's facial expression is relaxed, mood is happy, speech is clear, no general devices being used. Do you know where you are today, sir? Do you know what day of the week it is? Do you know what brings you to the hospital? Do you know your name? Patient is alert and oriented ×4. Patient's skin is evenly colored throughout, no wounds, lesions, or incisions. Patient's body temperature is warm throughout. Patient's skin turgor is good or elastic bilaterally. Patient's fingernails are smooth, pink, and round. No staining, debris, or clubbing of fingers. Patient's capillary refill is less than 10 seconds or less than 2 seconds on each digit. Patient's head is normal cephalic. Hair and scalp has no wounds, lesions, no infestations. Patient's face is symmetrical. Trachea is midline with no masses. And then I'm going to go ahead and use a cotton, and I'm going to swatch 4 parts of your face. Let me know when you feel it. Swatch, 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 swatch. And then I'm going to hold the side of the face. Can you clench your teeth for me, please? Okay, and I'm going to pull the chin. Cranial nerve 5, trigeminal is intact. Can you smile for me? Can you puff up your cheeks? Cranial nerve 7, facial is intact. Then I'm going to ask you push against my hands for resistance. And then push against my hands, shrug your shoulders. Cranial nerve 11, spinal accessory is intact. Then I'm going to go ahead and check the eyes. Patient's eyes are symmetrical with no infestations on the eyebrows, eyelids, or lashes. No redness or drainage or discharge. Then I'm going to measure the patient's pupils. Patient's pupils are equal by 6 millimeters. And I'm going to check the constriction of the pupils. Patient's pupils react to light. I'm going to check accommodation. Pupils are equal round, react to light, and accommodation. Then I'm going to check the 6 fields of gaze, the cardinal fields of gaze. I'm going to go follow the tip of my pen. Cranial nerve 3, ocular motor 4, trochlear, and 6, abducens is intact. I'm going to go ahead and check the patient's ears. Patient's ears are symmetrical on both sides, no redness or drainage. I'm going to go ahead and do a whisper test. No redness or drainage, and then no piercings noted. I'm going to go and do a whisper test. Can you repeat these words back to me, sir? Red, yellow, blue. Green, yellow, red. Cranial nerve 8, acoustic is intact. Then I'm going to check the patient's nose. Patient's nose is midline with no patient's nose is midline and symmetrical. No redness or drainage. Can you look up for me, sir? No asymmetry, no inflammation, and no drainage or discharge, and no deformities. I'm going to check the patency of the nose. Can you close one nostril? Breathe in for me. Breathe in again. Both nostrils are patent. Then I'm going to check the patient's mouth. Patient's lips are pink and moist. Lips are appropriate color for ethnicity. Can you open your mouth for me, please? Patient's gums, palate, pharynx, and tongue is pink and moist. All teeth are present. Can you say ah for me, please? Okay, cranial nerve 9, glossopharyngeal is intact. And can you swallow for me, please? Cranial nerve 10, vagus is intact. And then see. Cranial nerve 10, vagus is intact. And can you stick your tongue out and move it side to side for me, please? Cranial nerve 12, hypoglossal is intact. Then I am going to inspect the respiratory and auscultate. Patient's chest is appropriate color for ethnicity, no wounds, lesions, or incisions, no use of accessory muscles. I'm going to auscultate. Right upper lobe, left upper lobe, left upper lobe, right upper lobe, right middle lobe, left upper lobe, left lower lobe, right lower lobe. Breast sounds are clear and equal bilaterally. AP diameter is less than transverse diameter. I'm going to do the same for the back. So patient's back is appropriate color for ethnicity, no wounds, lesions, or incisions, and no visibility of lordosis, kyphosis, or scoliosis. I'm going to go ahead and auscultate the back as well. Left upper lobe, right upper lobe, right lower lobe, left lower lobe, left lower lobe, right lower lobe, right lower lobe, left lower lobe. Breath sounds are clear and equal bilaterally. Then I'm going to go ahead and do cardiovascular. So no jugular vein distension noted. Carotid pulse is normal rhythm, +2 bilaterally. I do it on myself. No brewery heard bilaterally. And I'm going to go ahead and auscultate the heart sounds. So, second right intercostal is aortic. Second left intercostal is pulmonic. Third left intercostal is Erb's point. Fourth left lower sternal border is tricuspid. Fifth left intercostal midclavicular is mitral. I'm going to do it again with the bell. Second right intercostal is aortic. Second left intercostal is pulmonic. Third left intercostal is Erb's point. Fourth left lower sternal border is tricuspid. Fifth left intercostal midclavicular is mitral. And then I'm going to test, palpate the radial pulses. Radial pulse is normal rhythm, +2 bilaterally. And then I'm going to go on to gastrointestinal. So now I'm going to check the radial pulse. Radial pulse is normal rhythm, +2 bilaterally. And I'm going to check all lower extremities and upper extremities for edema. No edema noted. And I'm also going to assess the posterior tibialis. You can't see. I'm going to assess the posterior tibialis on both sides. And I'm also going to palpate the dorsalis pedis bilaterally. Normal rhythm +2 bilaterally for the dorsalis pedis and the posterior tibialis. And then I'm going to check the gastrointestinal. So I'm going to look. Patient's abdomen is flat and symmetrical. Contour is, or skin is appropriate for ethnicity. No wounds, lesions, or incisions. Then I'm going to auscultate the abdomen. right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No more active vowel sounds for all 4 quadrants. Then I'm going to palpate each quadrant. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No tenderness or distension noted in all 4 quadrants. Then I'm going to check the shoulders. So I'm going to palpate the shoulders. Shoulders are evenly colored throughout, no wounds, lesions, or incisions. Bony promises are the same, contours the same. Both shoulders are symmetrical. Then I'm going to test the range of motion. I'm going to tell the patient, keep his arms out back, put it behind your back, keep raise it up high, put it behind your head. Range of motion is at 5 for the shoulders. And now I'm going to go ahead and check the wrist. I'm going to palpate. No tenderness or distension noted. Patient's wrist is evenly colored throughout. No wounds, lesions, or incisions. Then I'm going to check the range of motion. No bony promises. No distension or tenderness on each hand bilaterally. Then I'm going to check the range of motion. So I'm going to go down, up, down. This, like this. Range of motion in the wrist is at 5 bilaterally. And then I'm going to test the muscle strength in the arm. So I'm going to push down and get resistance. Muscle strength is at 5 bilaterally. I'm going to go down to the hips. Patient's hips are symmetrical. Contour is the same. And I'm going to test the range of motion. I'm going to tell him out, to the side, knees to chest. Out, to the side, knees to chest. Patient's range of motion is at 5 bilaterally. And then I'm going to test the ankle. The ankles have the same contour bilaterally. So both symmetrical bilaterally, evenly colored throughout, no wounds, lesions, or incisions. And then I'm going to test the range of motion for the ankles. So I'm going to go up, down, side, side, up, down, side, side. Range of motion is at 5 bilaterally. Then I'm going to test the muscle strength for the legs. I'm going to tell them to push against for resistance. Muscle strength for the legs is at 5 bilaterally. I'm going to test the sensation in the bottom of the feet. Tell me when you feel me touch your toes. Yes, 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 yes. I'm going to do the other side. Yes, 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 yes. Sensation is intact. Then I'm going to tell them to do gait. So walk from this table to the other end. Gait is effortless and rhythmic. Then I'm going to go ahead and do the closure. So on the pain scale, 0 to 10, 0 being no pain, 10 being extreme pain, where are you today? Okay, and is there anything else I can do for you? No? Alrighty. So I'm going to go ahead and lower the bed. I'm going to lock the bed, raise the bed rails with the call light within reach. Thank you for having me today.